Well, everybody, I guess it's time to start. That's
Yeah.
a fascinating conversation, and we'll certainly have
Yeah.
it for a new roundtable in the future. But I just wanted to welcome everybody to the meeting today. I'm Barbara Derrick, the Executive Director of Smoke Free SC, and as you can tell, I am at Edisto on vacation today. But I'm going to turn it over to Tara to introduce our speakers, and I'm glad y'all are here, and I'll be back in a short bit.
Hi, everyone. Thanks for joining us for our Friday Tobacco Partners Roundtable meeting. We're excited to have Tobacco Free York County Coalition here, Dr. Dave Keely and Aaron Paradiso to share about the exciting things that their coalition has been working on the past year. Beth Johnson from ACS CAN will hopefully be attending later on in the meeting to give us a legislative update. She'll be joining at the end if she is able to join. So we have a lot of exciting things to hear about today. As always, we record these meetings and we put them on our website the following week, so you can rewatch, you can share it with people who may have missed it, and we share slides on our Tobacco Partners listserv. So make sure you join that if you want to be able to access the slides as well. Also, one other quick shout out. Today's the last day of early bird registration for the Smoke Free SC Summit. So if you haven't already registered for that, do so today so you can take advantage of that early bird discount. We're excited to have all of you here. I think we're is it 3 weeks away now? Maybe only 2. 1, 2. So yeah, a little less than 3. So we're excited to see all of y'all soon. I'm going to hand it over to Dave and Aaron, and I'm going to let them finish the rest of the presentation until Beth arrives. So thanks, y'all. Thanks for joining us.
Okay. Thanks, Tara. Thanks, Barbara. It's good to be here. And I'll have to just start off with a quick thought. Every time I type Tobacco Partners Roundtable, I think I should be anti-Tobacco Partners Roundtable. Anyway, just a thought. Yeah, we have, let's see. Okay. I have a little bit of difficulty saving this PowerPoint, so I'm going to have to do it from this this view. Hopefully, you can see it. And I have to. We got somebody needs to mute. I have. It's an honor and a privilege to present at the roundtable. There's a lot of good work going on in other parts of the state, so it's not like we have a corner on how to do it, but we're going to tell you some more about what's been going on in York County, and maybe some of the other counties can share in a similar way going forward. We are the Tobacco Free York County Coalition. We've been in existence for 15 years. This is pre-COVID. We've done tabling events, and we're now back doing tabling events. We have, a array of things that we push, mainly is TRL, tobacco retail licensure, and pushing back against underage youth vaping. And so we have Macy and Aaron both on today's call, and there they are. This is at York Tech. They had a wellness fair. There's our handles, the website, and this is our official logo. These are let's see. Okay, yeah. Our TRL initiative, we're going to talk about, has progressed. This is kind of a quick history. This is what I showed last year, and we're moving forward. Whoops, let's see, they're supposed to be hidden. And these are the points that we covered last June. I'm not going to read those, but we really were at that point relishing in the results of the 2022 survey that we did, and looking for a good message to take to our county. And as you all know, we did make the decision after discussion with planning and zoning officials at the city and county level, to pursue tobacco retail licensure as opposed to a zoning ordinance. Well, actually, a zoning change, as TRL is an ordinance process. So this is what were our next steps this time in June of last year, and we've continued. You can see at the bottom, the community education event. Well, we found that things were moving along more slowly, getting meetings with our council members. There was an election in Rock Hill and York County, so we had to wait for the results of those. So but we continued to grow our social media following, and we'll talk about that. Skip through these. Our key initiatives as a coalition got listed here and highlighted are the ones we're going to be concentrating on. The point of sale surveillance and policy analysis was supported by the impact grants from Smoke Free SC, and then pushing back and, well, educating on and pushing back against underage ends use. We do have a number of key partners that have emerged over the years, and most exciting is what we're able to do with our youth alcohol and drug abuse prevention group called York County All on Board, and our 4 public school districts. Regionally, of course, we have great support from Smoke Free SC, and we're tied in with, of course, Sharon and the Midlands folks from DHEC, Midlands region, and we have continuing communication with Tobacco Free Mecklenburg, and they are so jealous of us if we can get tobacco retail licensure. And we continue to draw on the great resources at the national level from, of course, our partnership with Counter Tools. Jackie's on the call, and then the great material that's available at the Truth Initiative, Parents Against Vaping, and Tobacco Free Kids. Among our newest partners, Impact York County is supported by a Duke grant, Duke Endowment grant, and is working on the breaking down of silos, and is helping to pull off the county health, the CHIP. What is it, Sharon? It's the Community Health Improvement Plan.
Improvement Plan. Yep. Community Health Improvement Plan.
Yep. And we have tobacco in there as part of the behavioral health focus, and also as part of the chronic disease management focus. These slides that you're going to see now are ones that we put together to speak with school boards, with elected officials. And so part 1, we really want to get the message across that there's a vaping epidemic in our, well, really down to the elementary school level now. We've learned the kids are carrying vapes to school to show their friends. Middle school and high school, of course. And, that's a picture we wouldn't have seen 10 years ago. But the marketing by Juul and Puff companies, has really engaged so many kids. Here's a Puff bar, one of the most popular disposables. This is a 2018 map of where this was actually from the Jewel website. They were showing, you know, all the places you could go to get Jewel. And that I'm sure is, if we're working on some new maps, and so we'll have a new map to show everywhere you can get a vape product here coming along. But that's, you know, that's York County. You can see Rock Hill with so many point dots. So what we talk about with elected officials is some of this really current information coming from the Truth Initiative. This being a critical time, particularly coming out of COVID and kids using, you know, nicotine to self-medicate with the idea that it helps their anxiety. And, you know, now that kids are back in school, there's, you know, the peer element is there. And there's the mention about the kids turning to nicotine for stress, anxiety, depression. And, you know, so it's a colliding crisis. I think that's a good term to apply. The synthetic nicotine, you know, there's been the challenge that Puff Bar says their nicotine does not come from plants, and so they should be exempt from the FDA's rulings, but that is currently being challenged. Sharon might be able to comment on the timetable, but Puff Corporation is about to get their hands slapped in a severe way, I think. And just a reminder, we remind elected officials that it only takes 5 milligrams of nicotine a day. That's about a quarter of a joule to establish an addiction. Aaron calculated with one of the bigger tank, the tank vapes that has 45 milligrams of nicotine. That's equivalent to 2.5 packs of cigarettes if the kid goes through that in one day. And you may remember that you know, the you know, average for 1 joule is equivalent to 20 cigarettes in terms of nicotine delivery. Flavors, you know, it's the kids. This is Truth Initiative slide. You know, that's a key. The flavors are what attracts. And then also kids have switched over to disposables. That way, you know, they don't spend a lot of money on a refillable. They just get this lower cost disposables that are discounted many times. And as you see, Puff Bar, most popular disposable, Jewel, most popular reusable. And this is from, I think, data that they put together. We got these slides in the late 2022. We also emphasize age differences, that it's the youth and young adults that are most, you know, by studies at the NIH, the leading reason flavors are really high among youth and young adults, respectively, compared to adults over 25. And, you know, the FDA is reporting on current use. You see this 97% figure is it's one of the highest I've seen. And we also emphasize these, you know, this slide is, you know, a little bit busy, but you can see I have in brackets electronic cigarettes, the purple graph, and you can see the years 18 through 21 and how electronic cigarettes have, in terms of buy rates, SINARS data, that's just going way up. And then another one we'd like to show that merchants are doing. You can see the top graph lines are asking to see an ID, visible ID checking, but the ones that are down are the age verification equipment used and that the merchant actually studied the ID. We have to emphasize that tobacco 21 is the law of the land. A lot of people are confused, still thinking it's 18. Then we developed this, we have Canva, and we use that a lot to develop materials for our media. And back to school, we produced this back in September and have used it really throughout the school year, just emphasizing that that picture in the upper left, that kids are using disposable vapes that look like school supplies. Then the second part of the talk, we hone in on tobacco retail licensure. We make the comparison between alcohol retailers, tobacco retailers. You can see the top four are, very similar, and we do make the case. A lot of folks we talk to don't realize that you don't have to have a license to sell tobacco in our county or in their state as required for alcohol retail sales. The no pharmacies and the limit on site advertising are areas that we like to mention to kind of plant the seed that we can, take those actions with a retail license ordinance. And then this one really catches people's attention. The amount of money that's spent on marketing, they can hardly believe that it's $200 million in South Carolina being spent on marketing tobacco products. And then the 9.1 billion also kind of blows people away. So, we emphasize that that's what we're up against, and we need to push back. We just remind folks that sex sells, and the alcohol. We also emphasize where the product advertising is. And this, I took these photos. We have several QT stations in our area, and all of them have this jewel right on the door, where you can see the door handle at the bottom right. And, you're walking in, and there it is, jewel, front door, side door, doesn't matter. Then we show these, the puff company, makes, how these cranberry lemon ice and papaya strawberry, are these are flavors that that kids, want to try. This is the other one pager that we've developed, and just to kind of get it in that, people can be educated. We feel that we need to have constituents educated so that when it comes time for any kind of voting, the elected officials feel like they've got their support of their constituents. And so this is what we developed. Jackie Boards helped us and did a great job creating a 3-page handout that we also selectively use, particularly with our elected officials. Why point of sale matters, info from our store assessments. Particularly, we're able to show how high the percentage of menthol cigarettes being sold is, as well as flavored cigarillos, little cigars or blunts. That is again, it's the marketing, and it's also marketing for minorities. We know that the African American young adults, are really attracted to menthol and the flavored cigarillos. And then we have this page that summarizes the key points of the benefits of tobacco retailer licensing, and it references our 2019 telephone public opinion survey that found that we had almost 60% of respondents favored keeping tobacco products out of view. Other ways that we can push back on with tobacco vaping with tobacco retail licensure. This Change Lab Solutions 4-pager we also give to elected officials. It's really good. It lays out the definitions of terminology. We also then have been emphasizing that in this national study, 47% of kids, high schoolers, reported that they are able to go into a retail store and buy. So that's why we want to show our elected officials that we need to be knowing where these retailers are positioned in the county and push back. So here's our 2021 map. We're in the process of updating this of 500 feet. You see the darker red dots. This is the downtown view of Rock Hill. And then proximity to schools or parks, you see the red dots. The pink halo is the 1,000 feet, and the red dots are within a proximity of schools. So we have a good case to make, and we've got the support of the Rock Hill School District School Board to move ahead with tobacco retail licensure. They haven't passed a resolution, but I feel they would if we asked them. So we emphasize why all this is important, and the effect of the COVID-19 pandemic on all this, and the lack of enforcement of the under 21 restriction. There's I said 47, I'm sorry, 43 retail store and vape shops and gas station convenience stores were the primary sites, which we have plenty of here in York County, and more vape shops popping up. So the younger male was the characteristic in this 43% survey. So comprehensive retail regulations to help restrict tobacco product access are needed to reduce e-cigarette use among young people. It was the conclusion of the study, and we emphasize that's what we're trying to do. And then our bottom line, the proximity to schools, parks, vulnerable neighborhoods. We're creating maps to show those, particularly the lower income households, and predominantly people, persons of color neighborhoods that still exist in Rock Hill. We cite a published article about county in California, Kern County, and we have information in that study that talking about how to structure fees and penalties. And they report in the study that in 2016, they had 12% of tobacco retailers violated their TRL, and 2 years later, they had got with the new TRL, they had that down to 4%. So that's our basis for convincing folks that this is going to be an effective intervention. And our ask, this is that what we've been saying to the school district folks and the county council and the city councils, and we've asked them to help inform their constituents as well. whoops. We talked at the beginning about, before we started the meeting, about Winthrop University. The campus does not allow indoor smoking or vaping, but as Aaron mentioned, that's enforcement of that may be in question. But the campus still has 15 designated smoking areas outdoors around the campus. So last September, we connected with Council of Student Leaders and the president about the Truth Initiative grant opportunity that it was offered and has been offered. And so, Barbara, you made a comment about Smoke-Free SC helping. We are looking into whether Truth Initiative is going to offer that same type of grant in 2023. And as Aaron mentioned, yeah, we've got actually the new CSL president is a woman. And so we're going to meet with her and talk this up. And now that the new president at Winthrop will be wrapping up his first year, we will look to meet with the new president as well over the summer with the help of the CSL president. Want to also take a few minutes, and Aaron, you can jump in here. Our social media, I'm convinced, is going to be a really important force in getting constituents educated. And so these are from left to right are the top 3 biggest reach posts to Facebook that Aaron and our team have put out there. And here are our biggest reach Instagram posts. Aaron, I didn't put the numbers up here.
Yeah, for Facebook, we're averaging, I think the highest one had about 80 views and the lowest was about 30. And for Instagram, it's usually somewhere around 850 to 300. And Alana Visbeck, who's one of our volunteers, is amazing. She makes a lot of the graphics for us for posting, and I just do the scheduling. In the last year, we've reached over 6,000 people on Facebook and about 3,500 on Instagram. We had a spike for both around September of last year, which was awesome because we did a lot of back to school and vape centric and student led kind of graphics and information. We did a big push there. A lot of the stuff that's about kind of quit line stuff and then different products and marketing techniques has definitely been a big impact. And then our little win this year was that on Instagram and Twitter, both the Truth Initiative and Tobacco Free Kids with their Take Down Tobacco account have acknowledged or recognized us on both of those. So that was like our little win.
Yeah. All right. We are, as I mentioned, working to talk with all 4 public school districts in York County. And as I mentioned, even reaching down to the elementary school level. On the left there is the photo of our confiscated vapes, almost 200 confiscated vapes from 2 large high schools in Rock Hill from August to December. So, this is an eye catcher when we do a tabling event. And then here are some more of our Instagram posts. We are, doing lots of, I think, really important posts to tie in with, with like National Minority Health Month and LGBTQ awareness. And we're trying to just get our faces out there. And we've been on the local radio and WRHI, 2 programs, and also with we've been on the CN2 cable TV, and just really good work by Aaron and Alana, and now Macy's joined our team and helping as well. Things we've learned from elected officials, one-on-one conversations. This has been a big part of the way we've approached things, is to get the elected officials out of their daily routine and meet with them. And so we've gotten, really from elected officials saying, let's get our school district administrators educated, get school board support. So that's been going well. We've been advised that we need to hear the underage youth voices and create messaging to them that they will trust, that when we're talking about retail licensing, we're not the tobacco police, but we are trying to protect them from getting nicotine addicted. And then we've also gotten some good pointers on how to tie in tobacco retail licensing with current issues. Like Rock Hill has been troubled by the vape shops not following the sign ordinance, either with signage, the size, or the lighting. They have specific restrictions in the ordinance. So they are looking to see the retail license as a way for them to know where these places are, and might even build in a non-compliance to the signage would potentially lead to a penalty related to their tobacco license, retail license. And then we get the question, well, why do we have to do this in York County? This should be done at the state level. Well, Beth can probably mention that, any state level bill related to tobacco is always at risk for getting preemption tagged on it, which indeed happened with the state TRL bill. And there's just not enough momentum. And we know that, with indoor tobacco smoke exposure, we did our ordinance in 2010, and here we are 13 years later, and we've saved lives, and there's still no action's been taken at the state level. For the coming months, we're going to be continuing to expand our education, community education, with hybrid meetings. We've been able to, with Smoke Free SC grant support, to add staff time to be able to pull these off. We're going to do them hybrid so that we can then post the key content on our social media and website. Strategically placed, basically have 4 key areas in the county, 3 with high growth, Rock Hill, Fort Mill, and Lake Wiley, Clover. And then the western part of the county, where the county seat is, is more of a rural mindset. So we've got to tailor our messaging appropriately there. We will continue in communication with our champions, and that'll be important as Rock Hill city elections occur in October. We do have 5 members of the Rock Hill City Council who we feel would go ahead and vote in favor of pursuing the ordinance. So we'll have to make sure that they get reelected if they're up for election. And tabling events, we find that maybe we don't see that many people, but boy, do we get good networking when we're at tabling events, because there are other members of the health and wellness awareness organizations that are present at those events. And then, there is a draft model ordinance that is been, tailored to South Carolina, but we still have to meet with the attorneys and let them look at it, and we do have the support of our actually at the Smoke Free SC Summit, Mark Meany is going to be present, and he is with the tobacco legal consortium and nationally, and I've talked with him, and he's going to help us with any questions that come up about our ordinance. Okay, so that's what I wanted to cover. We've got some time for questions and for discussion, and I'll leave this up if you want to get our QR code, check out our website and our social media. And I'll stop there. Any questions? Erin, you want to add anything at all at this point?
I was going to say the next upcoming things that we've got that I'm excited about is we're doing a 5K that's hosted by our local substance use center in May. And then we just heard how we can start tabling at the Rock Hill Pride events that happen in June. And then we're going to hopefully lead into some back to school stuff at the end of the summer. So hopefully the next couple months will be pretty busy.
Great presentation, guys. Your list of partners is amazing and something that everybody would love to duplicate and have that kind of support everywhere. And as I love to rave every single time I get on here, your social media is fantastic, and we would we try to forward everything you send to us because it is amazing.
Oh, it is a lot of Atlanta.
Yeah, I mean those numbers are that's a lot of growth in 2 years. So
Thank you.
Anybody have any questions?
Again, we don't have a corner on the best techniques. There are other folks I know in Greenville and Charleston who are also doing great work. So, but if we can be helpful for anybody that's, on any of these things that I've talked about, feel free to contact us. All right.
Beth, I think you're muted.
Yeah.
Sorry, I thought my mute button was off. Thank you. How many members are on city council?
7.
7. And you think you guys already have 5 that may be in favor?
Yep.
We need to pass this before preemption.
Yep. Including the mayor. The mayor was around when we did the indoor comprehensive ordinance, and so he gets it, and so we're looking to get this thing going. Yep.
That will be really great. Let us know. I know we have a few national partners on the call, and we're all kind of following the state preemption. But I mean, if we can make it through sine die, as soon as sine die is over, you have our 100% attention, and we want to help you guys get this passed soon.
All right.
Beth, when is sine die?
6 days. Whew. May the 11th is sine die. So we have 6 days.
And I hear that the abortion issue has now been handled, right?
Yes. Yeah, so, I'll give an update whenever you guys are ready.
Oh, yeah. Okay. Sorry.
No, I want to just give you guys time because y'all are doing amazing stuff. Thank you so much.
Yeah. Thank you guys for a great presentation.
Okay. Yeah, I mean, I can't say enough. I mean, Beth and the ACS CAN regional folks have helped us, think about messaging. Jackie Boards is helping us continue to work on messaging. And we've got the Heart Association regional guy helping us with messaging. So stay tuned. We're going to continue to have hopefully some very good engagement with our messaging and through our community events. Yep.
All right, Beth, I guess it's time for you.
Okay. So thank you. Sine die is it for, and so I say sine die to my friends and they're like, what is that? What does that mean? Sine die is the last day of regular legislative session. And so the end of session is 6 days away, May the 11th. We have 2 weeks to stay out of the spotlight. So just a real quick, the House bill preemption for flavors and tobacco retail licensing that we've been fighting for 6 years. The House bill made crossover, so it is now in the Senate. And the Senate Medical Affairs Committee pulled it out this week, which meant they decided not to hear debate on it because they had already heard testimony on the Senate version. So we have 3 bills floating around. We have the House original version of preemption, the Senate's original version of preemption, and then we have a Senate bill that would create a statewide tobacco retail license, and it has been amended to include preemption. So we want to kill all 3. That's the goal. We want to kill all 3. It's interesting that we've kind of been hearing all along, for the past few weeks, the last 2 weeks of session, all eyes are on us. And I really feel like that is where we are right now. We are hopeful that we can hold things off, and we are hopeful to be able to do that because of some rules in the Senate and the way they're playing with the rules. And Dr. Keely, that's exactly what they did yesterday when they ended the abortion debate. This was a really interesting debate. The House passed a near total abortion ban, and it went to the Senate, and the Senate had been debating it since Tuesday, and they were able to kind of manipulate the rules a little bit and continued the bill. Instead of carried over, they continued the bill, in which means that they ended debate on the bill for this session. No more debate allowed for this year, but it will be carried over until next year, and they will be able to begin debate again in January. I've gotten some intel that we are up next. And so what this means is that preemption will likely be set for special order. But before that, even, we have to find members to object to the bill. And there's some trickery happening, some playing around with members and votes happening that I don't know 100% about yet, and that's okay, as long as they don't put us for special order and don't get to debate the bill. And so so that's our best guess right now. Our best hope is that the debate does not come up for the House bill, especially, which is likely the vehicle that they would use to move preemption, because it just needs 1 vote and it's passed. It goes to the governor. And then the other 2 preemption bills that are Senate generated bills would have to go back to the House. And I don't think that they could. The House could. They have time. But I think it would be a real challenge for them to get those bills moving. So we need everyone kind of calling. Calling is the best thing right now. Calling your member, your senator, and asking them to do not prioritize tobacco preemption. We have lots of talking points. We have lots of 1-pagers. We can share those with everyone. But our best bet is just simply saying, why are you putting big tobacco over children and family and kids and health? And it was really interesting to me last week that I listened into a committee, and there were probably, 10 or 12 or more mayors who were testifying on home rule, which is this issue that we call preemption home rule. And so the issue, though, was short-term rentals, and whether the state or the city, county, should have the authority to regulate short-term rentals. And it's really interesting to me and really disturbing to me that the municipal association rallied the mayors to speak against or speak for home rule as it relates to short-term rentals, but refuse to rally the mayors when it comes to tobacco. So the mayors, our cities, don't really know about this issue still. Some of them do, as we talk to them and we tell them one-on-one, but the municipal association, in my opinion, they have clearly chosen not to prioritize health and tobacco, and for whatever reasons we can all draw our own conclusions, but it was really good to hear the mayors come and speak about how much they value home rule. And I'm hoping that we can take some of those arguments and flip it and use it as we talk about tobacco preemption. Home rule is home rule. So anyway, it was interesting to hear them. And so 2 things to ask you to do is call your senator and let your mayor know about this. If you haven't already, let your mayor, go to your mayor and let them know that this is happening. And I think that I can't think of any mayor who would not agree that home rule is home rule. And once you start down that path of removing the local control from any issue, then you're going to run into problems if you start removing that local control for tobacco and for housing, and then what else? So quick update, happy to answer any questions, and thank you guys all for what you're doing and continue to do. It has been a crazy long year. We came out the gate fighting, and we are still fighting.
Poor Beth, I don't know when you sleep.
Yeah, I mean, it's been an interesting session. But
It has.
it's good.
Yeah, I just want to give Beth kudos. I know us at the national health organizations are so grateful for all of her, work on the ground. I mean, it's a lot.
Thank you.
Appreciate
Dana.
you.
Thank you. We have lots of great partners.
I mean, there's this wheeling and dealing going on behind the scenes.
Yeah. Big time.
And, I mean, as far as being able to really block efforts to get debate,
Mhm.
that's what we need to be saying to our senators? Vote against special order?
That's right. Yes.
Okay.
That's right. That's the first step, Dr. Keely. And so well, it's like a step, it's like a half step, because out of the 3 bills, only one of them is being objected to currently. And as long as there is an objection on the bill, then it has to be set for special order. If there's an objection on the bill, they cannot debate until that objection is pulled off, or they set it for special order.
Okay.
And the Senate Majority Leader has the power to set it for special order because he has the votes. So he has that power. And there's also this rule in the last 2 weeks of session that instead of the required 2/3 vote to set it to special order, all he needs is a simple majority.
Oh, no. Oh, really?
Right.
Last
Even
2
worse.
weeks.
Yeah. So that's why this last 2 weeks is going to be all eyes on us. There's a lot of different issues that are being objected to. The hate crimes bill, medical marijuana, sports betting, critical race theory. There's a lot of other issues that are more important than tobacco preemption. However, there's not the will of the body in the Senate to debate tobacco preemption like there are those other issues. So my guess is they will try to set the bill to special order early next week so that they can set it to special order quickly, not take debate, and quickly get it out. That would be my guess. But there are 2 bills, the House version and then the Senate TRL bill, retail license bill with preemption. Those 2 bills currently do not have objections on them, which is tricky because they did have objections, and the senator who was objecting removed his name just this week during the abortion debate. So that's why I say there's a lot of backroom deals happening right now. There's a lot of vote trading, for lack of a better word. They're not supposed to do that. They say they don't, but that's what happens, right?
Yeah.
So there's a lot of that. There's a lot of that in play. There's a lot of rules that certain members of the Senate were furious yesterday when the rule was flipped on them and it ended the debate. And because of that, some of them called immediately for the Senate to end for the day completely. And then what I'm hearing is that because of the abortion debate ending so abruptly, that some members in the Senate will now object to everything that's going to come up in these last 6 days.
Oh,
That'd be our best case. That'd be our best case scenario.
yeah.
So
Yeah.
there's a lot of things at play.
Okay.
The message is to your senators: do not prioritize tobacco preemption. That's all I need to say. Do not prioritize tobacco preemption, period. The message to the mayors is home rule is home rule. This is a slippery slope. If you want to keep your rights as a city, as the mayor, then you will tell your senator to stop preemption.
Okay.
Yeah, crazy town. It is crazy town right now up there.
Well, we'll definitely keep our fingers crossed for you, Beth.
Yeah.
Do
Yeah.
everything that
Thank
we
you.
can for you.
Yeah.
And,
Yeah.
Oh, and I've got to jump on another national partner call that Dana and I are both on, but thank you guys so much. And I appreciate all that y'all are giving and doing. And Dr. Keely, I talk about you and Aaron all the time because y'all are like just my heroes with local work. Thank you. Thank you.
They are stars. Thank you, Beth. We appreciate it.
Thanks, Beth.
Thank
Yeah.
you, Beth.
I think Tara was going to try and put our one pager in the chat. And I'm not sure if it worked or not, but if not, we
Yeah,
will
it
send it
just-
out to everybody. Good, it did. And
just
I know Dana put something out there too. So
It
thank
might be
you
the same
again.
thing because we sent that same document to, well, hers is an official, like you can type in your information, it will send something automatically for you.
Yeah. But I just want to thank Dave and Aaron so much for your presentation today. It's always great to hear what's going on, and y'all are just the forerunners of the state. We all salute you and we appreciate it.
Yeah.
As you all know, I'm on vacation. Here's my newest niece. She's 3 months old in another 6 days. And I did want to mention that next month we're going to have Irene McCarthy and Tobacco Free Mecklenburg to talk about their work. They've got a great program too. So I think that'll be real interesting.
Yeah.
And as Tara always likes to tell you, we're going to we'll put this recording on our website in the next couple of days. So thank you so much. Anything else, Tara?
I was just going to clarify that Irene will be on in June.
June. Oh, that's right. We don't have one in May because we have a conference that we want everybody to register for. That's right.
And I just put the registration link in the chat bar. It's the last, like I said at the beginning, the last day of early bird registration. So take advantage of that while you can.
And Sharon, we're up to about 85, 90 now. So we're doing good.
Okay. I heard that there was going to be about 10 to 15 coming from the upstate. So it sounds like those must have kicked in.
Yeah.
Good,
So
good.
That's great.
Wonderful.
Excellent.
All righty,
Yes.
guys.
Speaking of the upstate, I need to call out David Francis. He's on the call. He's our Heart Association regional guy, and I appreciate what he's offered to us. There he is. And
Hey, David.
How y'all doing?
yeah,
Welcome.
he's
Thank
a
you.
great partner, and good to have his expertise. He's got a lot of expertise from doing TRL in Florida. Yeah.
Yeah, before they preempted it. So hopefully y'all get it in before that. What happened to us? We had like 35 campaigns moving all around the state, and then all of a sudden, nope.
Yeah.
So
Yeah.
hopefully, and I will say, just from that experience, there is a cascading effect. If you can get one local TRL and just kind of domino effect it out, it was really starting to catch. And then the first one is the hardest, and Alachua County, which is Gainesville, Florida, passed a very comprehensive TRL before preemption, and then that's what triggered all these other campaigns. And the state said, "We'll take care of it," and they never did. I mean, they passed a horrible state bill. So hopefully you guys get done. Y'all have amazing work. It looks like y'all are ready to go. So anything Heart Association can do, please let us know. Dr. Keely, I looked over the social media. I think you have everything that we have right now, but if anything else comes out, I'll make sure y'all have it.
All right.
Thank
Thanks
you,
again. Yeah. Right.
Yeah, absolutely.
And Ava, I meant to tell you that when we met with South Carolina State, they mentioned your programs in Dillon and Allendale. And so we will be reaching out to you to talk to you if there's some way they can help you.
That would be great. Thank you.
All right, good. All right, I think that's it for today. Thank you, everybody.